Welcome to Sports Ophthalmology, a podcast for ophthalmologists and trainees interested in providing eye care to athletes. I am your host, Jared Tuttle. Join me as we hear from national leaders in this exciting subfield of ophthalmology.
Hey everyone, I'm Sydney, one of the new co-hosts for the Sports Ophthalmology podcast. And today I'll be talking with Dr. Andrew Lee about the intersection of sports ophthalmology and neuro-ophthalmology, as well as some of his recent work in the field. Dr. Andrew Lee is a neuro-ophthalmologist in Houston, Texas. He received his MD and completed his internship year at University of Virginia School of Medicine. He completed his ophthalmology residency at Baylor College of Medicine in Houston and his neuro-ophthalmology fellowship at Johns Hopkins Hospital in Baltimore. Dr. Lee is the chairman of the Department of Ophthalmology for the Blanton Eye Institute at Houston Methodist Hospital. He also serves as a professor of ophthalmology, neurology, and neurosurgery at Weill Cornell Medical College and as adjunct professor of ophthalmology at the University of Iowa and Baylor College of Medicine. All right, Dr. Lee, it's an honor to have you on the podcast. Thank you for joining me today.
Thanks for having me.
So, in addition to practicing neuro-ophthalmology, I know you're also very involved in educating others about the field, both in person and through your very popular YouTube channel, Neuro-Ophthalmology with Dr. Andrew Lee, or NODAL. Could you tell us a little bit about what drew you to the field of neuro-ophthalmology?
So neuro-ophthalmology is the field that bridges the gap between ophthalmology and neurology. The difference is a neuro-ophthalmologist can actually look in the eye and see the pathology. And so we can actually see whether people are getting better or worse. And it's the only place in the body where you can actually directly visualize central nervous system. So it's all the advantages of ophthalmology in terms of our toys and technology and imaging combined with the localization of neurology.
And so, when it comes to that, what are your thoughts on the intersection of sports and neuro-ophthalmology?
So a lot of sports, as a lot of things in life are directly tied to visual acuity, visual field, and making judgments that require eye-hand coordination. For example, in sports, the difference between being a Hall of Famer and just being a AAA farm player in baseball is like very, very little in terms of the swing. And so sports has always been related to ophthalmology, and in particular neuro-ophthalmology. We're just better at studying it now.
And how did you yourself get first involved in sports ophthalmology?
So one of the ways we got involved is technology has progressed to the point where machines can now make difficult calls on the field, and instant replay has changed the dynamics of the game in terms of making sure the call is correct and analyzing and challenging calls on the field that can be reversed. And so our initial interest was in sports refereeing. And it turns out that there are very few things that error can occur in a sports-related referee call, and it's not what you think it is. Normally people think of, oh, ref, are you blind or do you need glasses? But it's hardly ever their visual acuity. It's usually their visual field, which is they're too close or too far from the action, their foveation prioritization, which is where they have their vision centered on and where it's supposed to go next. And this thing we call dynamic visual acuity, which is when you run, your eye goes up and down and your vestibular ocular reflex has to compensate for that motion. And that degradation in the vision, both in foveation time on the target, but also from the running itself, can contribute to errors in judgment on the field. And a camera doesn't have to worry about that. A camera just sees what it sees and it's not moving at all. And so working with the referees in the National Football League to help them make better calls on the field, but also preserve both the integrity of the game, but the personality of the game, was really how we got interested in the neuro-ophthalmology of sports.
Yeah, it's a really interesting side of it because, so often you're looking at the athlete, like performance vision. So to hear it coming from the side of the officiating, I think it's really interesting, especially with the technology that's coming out, as you said, because who knows what will happen as we move forward. I know you did do a study back in 2023 on these officials. Do you have any main takeaways that you got from when you spoke with them?
Yeah, so I think the main takeaways are sometimes our brains can fool us, and the brain is really good at turning off information that it doesn't think is important. So for example, during this dynamic visual acuity, when you're running, you actually don't notice that your eye is moving, even though it is. So what's really happening is when you move and you tilt your head, your eye has to rotate, but the counter roll against the head rotation is done as a reflex, which means you have no conscious awareness of it. So when you interview the game officials, they always said they didn't see that, even though they saw the film and they can see the replay. And I totally believe them when I say that. So we're not there to try and change their minds on what they saw or didn't see. What we're trying to do is make it so they have the best vantage point and they have the best foveation time, visual field, and reduce the dynamic visual acuity degradation on their vision. So we're just giving them the vocabulary to get in a better position to make a call. We're not really telling them to change their call.
Do you plan on taking this research in any sort of direction, or is there anything more to come looking at these officials?
Yeah, so we, game officials and players look at game tape all the time. They watch film. And so what we did and what we're trying to do is have small little film vignettes that represent neuro-ophthalmic principles, and then we give it to them back as a quiz so that they don't have to worry about doing it in real time. They can watch a little clip, and then we provide the vocabulary in terms of what we would answer. Which of the following is the cause of the miscalled play in the video clip shown? Is it loss of acuity, loss of field, foveation time, or dynamic visual acuity? And that way they get used to the vocabulary of it. And so our next step is to incorporate that training, those video modules, into simulations. So then we don't have to wait for a play that exemplifies what we're trying to show. We can just have the artificial intelligence build that play, and then we can run any number of infinite numbers of variations on the theme, and then they could play a little video game. And we already have video games for the gaming portion of it. So you can play football, you can play baseball on these video games. And what we'd like to do is do the same thing, but from a referee standpoint, a game official standpoint, and then they could replay it, and we can create our own scenarios and our own penalties, and it'll greatly reduce the amount of game film time you have to watch. I mean, of course, you still have to watch film because that's the real world, but in terms of teaching and learning and leveraging the technology to allow us both simulation, but also make it fun for the participants. And if we can gamify it just a little bit, it'll make it more interesting to learn and understand the principles without having to read books and things. It can just be simulations.
Wow, that's some really interesting stuff. What do you see, I guess, a purpose for any sort of head-mounted visual assessment tools when it comes to that, just like during an actual game or, competition, whatever it may be?
Yeah, so that's an interesting thing. The game officials right now are prototyping wearing such a device. The limiting factor has been the weight and the interfering with the play, but the technology is smaller and smaller and smaller, and so wearing a camera like a body cam on a policeman gives you their point of view. And right now what you have is cameras, but that's not really what the ref's point of view was. So a head mounted display version of game film from the referee perspective is something that we're very interested in, and also I think the professional leagues are interested in, so they can have a viewpoint on what is it that the game official is actually seeing, because the camera is very deceiving because it can go up and down and side to side, and that's not within the degrees of freedom of a person. Person can't fly over the play, and a machine can. So I think it's been very useful to have that kind of technology available to us. And now that it's smaller and miniaturized, it's not as obtrusive to the game.
Yeah, I can't wait to see where that goes, just as a sports fan myself. But it's interesting because, as you said, people are often upset with the officials. So as the technology gets better, it'll be really cool to see.
Yeah, and that's the other piece of this is the psychology of it. If you just had cameras, it would take something away from the game. I think fans like booing the ref, and they like applauding the ref, and they like the suspense of the call. Of course, they like having replay and making sure the call is right. But the actual number of calls that are reversed on the field is actually quite low. And so it just speaks directly to the experience and the accuracy of these game officials in real time, and that's part of the game now. So to me, I always tell the game officials, we're not trying to take your job, we're just making it easier for you to do your job.
Yeah, I could see that, them being a little bit worried about where this could potentially go. But yeah, I agree. The human error aspect of it is definitely something that is all a part of the game. So it'll be great to see where that goes. Switching gears a little bit, a big part of sports and recreational activities to consider, especially as ophthalmologists, is unfortunately the injuries that can occur. Outside of injuries to the eye itself, concussions are a major cause for concern. Being a neuro-ophthalmologist, I just, interested from your experience, what has the impact of concussion or traumatic brain injury been on the eyes and vision, short-term, long-term, things you've seen?
Yeah, so the whole issue of concussions, especially in the contact sports, is a huge issue. And what we're working on in that area is trying to develop on the field tests so we can know who needs to come off the field. Our current on the field tests are not that accurate. And clearly, there's a dose effect. The more times you take a concussion, the worse it is. And ironically, some of the countermeasures that have been deployed in the past seem to be protective, but they might actually be making concussions more likely. So a lot of the protective gear, like helmets and things, sometimes cause head to helmet on helmet injuries that are worse than would have happened if they didn't have a helmet. So looking at the science behind both avoiding head-to-head impacts and also having protective equipment that will protect the wearer from these traumatic brain injuries is important. The other thing that's interesting is the eye exam is usually normal in those patients, so it's more about processing and processing speed. And from a visual standpoint, it's hardly ever that they lost their acuity from a on-the-field injury to the head. It's usually a neurocognitive deficit that occurs way later. And so there's this delay between the time of the injury and the time that they start noticing the symptoms. So, of course, we'd like to reduce the number of concussions and the cumulative effect of multiple concussions on traumatic brain injury. And the areas that we're most interested in as a field is on the field assessments, but also developing better equipment and then rule changes that help reduce that type of injury. I mean, nobody wants to see anybody injured anymore. I mean, that's called being a gladiator, and we want to have professionals being able to do what they do best without getting injured.
Exactly. Would you say you've seen, especially with the rise of research in traumatic brain injuries, do you see any typical, either related to vision or really anything that might come up as we look more into this?
The most common complaints that we see in our traumatic brain injury patients, but not from just sports injuries, but military injuries as well, because in the military, the helmet and the body armor has protected individuals. So the types of injuries that we see now are amputations and then the traumatic brain injury. So they're shielded from the life-threatening shrapnel-based and projectile-based injuries, but they end up with this traumatic brain injury. And they often have very nonspecific complaints like blurred vision, double vision, but it's not really clear why they have it. So it's still an area of interest, and it shows you how much we don't understand about the brain. But because so many war injuries have occurred over the past few decades, a lot more money is being invested in traumatic brain injury. And so neuro-ophthalmology is going to benefit from that, both on screening patients, but also getting to the heart of what is it that they're complaining about.
Great. Say if a patient presents to the emergency department after a head trauma, they're being seen by, say a resident on call. Is there any sort of recommendations for what should be assessed, either by an ophthalmologist, neuro-ophthalmologist in that moment, or is it really just kind of following them, seeing if there's anything that comes up? It may be these non-specific symptoms, but anything they can essentially do preventatively?
Yeah, so we always have a full eye exam on all these traumatic brain injuries, and we're looking at their vision, their visual field, their pupil responses, their eye movements, and then, of course, a structural evaluation of the eye. So the most common injury that we see is eye movement disturbance, and that's usually from a nerve palsy. And so the eye might be crossed in or crossed out. So that causes double vision. And so in the brain, you might have a contusion or hemorrhage that produces a visual field defect. And In the optic nerve, it can just be one eye vision loss, but in the brain, of course, it's the right side of your brain controls the left side of your vision and left controls the right. So they get this like side vision problem where they can't see to the right or the left. So all these patients should have a full eye examination, not just to exclude ocular and orbital injuries, but looking for intracranial injuries, and for optic nerve, that's traumatic optic neuropathy, and for brain things, that's homonymous hemianopsia. And then the eye movement problems, cranial nerve palsies, diplopia. So they all have to have full eye examinations. But if they just have traumatic brain injury and they have imaging that doesn't show any lesion, then those patients are managed as an outpatient, and those ones are much harder, but those usually end up having some sort of rehab and multidisciplinary rehabilitation efforts to improve their function over time.
Great, thank you. And let's say there's a competitive athlete or just a recreational player of any sport. Say if they go to their primary care doctor and they're told they have a concussion after an injury. When it comes to anything potentially ophthalmology, neuro-ophthalmology related, is there anything that should keep them from returning to play, or how would you go about allowing them to get back to the sport or activity?
Yeah, so normally we test their visual field. If they have a visual field defect and a structural lesion, they cannot return to play. It's only the people that have no structural abnormality, full visual fields, and no diplopia. And then it becomes a matter of individual preference, but also what the team and the team physician want. So even if I say they can return to gameplay after their eye exam, it's not a one-person decision. And as you know, with professional sports, that can be a multi-million-dollar decision. So those decisions cannot be made by me. But we contribute by telling them about the eye exam and doing the visual field and making a structural assessment. Our general recommendation is people should be able to return to play if they feel comfortable with it, as long as they don't have a structural lesion or a visual field defect or double vision. But then it's up to their coach and their intra-organizational policies and procedures. That usually what drives return to play.
Great, thank you. This has really been helpful and enlightening. It's really cool to hear about this side of neuro-ophthalmology that we don't often talk about. So just a few questions in general we like to ask all of our interviewees. How would you advise a young or aspiring ophthalmologist interested in this side of sports ophthalmology or this side of neuro-ophthalmology? How would you advise them going forward?
So, of course, you should follow your passion, and if what interests you is the nexus of sports and ophthalmology, there is certainly a great body of literature that you could start with just on your own to read about what's already been done. Finding and engaging a mentor is a really important thing, and I think that there are plenty of people who are looking to help young people in this area. And then finally, there's areas for research and exploration. So if you've got an idea and you're intellectually curious and you want to test a hypothesis, I think that's what people like when they're looking for a mentee. And so I think there are plenty of people out there in the world of sports ophthalmology that are just looking for the next best thing, and someone who's enthusiastic, interested, and engaged should be able to contact those people, even if it's a cold call, and just say, hey, I'm interested in this. But if any of your listeners are interested, they can just contact me directly. I'm sure you'll be able to provide them with our contact information, or come visit us on our YouTube site. We're always looking for ideas that we can make a YouTube video out of.
Definitely. Yeah, we can definitely pass along your information, because I think, some of the stuff that you were talking about earlier has so much more that can be done with it. I'm sure it'll excite a lot of the listeners. And kind of off that and what we talked about a little bit, but where do you see the field of sports ophthalmology in general going in the future, whether it be related to the work you're doing or just as a whole?
I think that a lot of what we are working on can become standardized. So a lot of the training modules, a lot of things we talked about in terms of simulations are going to be artificial intelligence generated. And so we need to be able to work with AI in making sure that it's genuinely engaging the learners with realistic, but also genuine and authentic experiences. AI is really great at generating these things. The problem is it just makes stuff up too. So validating what the AI is saying is what human beings should be doing with that information, but it's sure going to make our world a lot more exciting and interesting when the AI can do a lot of the heavy lifting on the grunt work and the things that are probably less exciting. And I think that gameplay is going to remain with us. It's part of the human experience. And even with the invention of video games, you see that in-person games are still exciting to people, whether it's the Olympics or professional sports. There's something deeply human about watching other humans compete in a human activity. And I think that's never going to go away. And so we should just make it as enjoyable and as accessible to people as we can.
I think that's very true, and I agree completely. So I think it's only going to be an interesting prospect ahead of what will come of sports ophthalmology as such a new subfield. Last but not least, we do ask all our interviewees, what your favorite sport is and if you have a favorite sports team.
So, of course, all my favorite sports teams are right here in Houston, Texas. The Astros, the Texans, the Rockets. And my favorite sport is baseball. And I like it the most because it really engages me as a neuro-ophthalmologist because the swing, the pitches, it's a lot of statistics and numbers, and you can make predictions based on those numbers. And if you're a numbers person and a sports person, then baseball's the stat heaven for you.
I think that makes total sense to me. That's awesome. I love to hear it. And, thank you so much for taking the time to talk with us. And, listeners, as Dr. Lee said, check out his YouTube channel on everything neuro-ophthalmology and see where else he's taking the field of sports and neuro-ophthalmology. Thanks, Dr. Lee.
Thank you.
Thank you for listening to Sports Ophthalmology. To stay connected and learn more, you can find us on Twitter, YouTube, and at our website, sportsophthalmology.com.